I'm here today to walk you through some of the more common situations you will be faced with as you learn to live with your ostomy. We understand that each patient's experience is unique and personal, but hopefully today we can show you that you're not alone. We will introduce you to a patient who also happens to be a nurse living with an ostomy. Melissa will share some of her tips and experiences about how to live comfortably with an ostomy. We understand that your experience and your adjustment may be different than Melissa's. We recognize this is a life-altering and possibly devastating time in your life. If you're feeling overwhelmed, please seek support. A call to a nurse, an ostomy support group, a friend or family member can ease the transition. In these videos, we will address hydration, nutrition, recovery, progression, changing the appliance, overall quality of life.
I'm Melissa and I'm a nurse, but more importantly, I've lived with my ostomy for over 7 years. For me, the decision to have a permanent ileostomy came after fighting inflammatory bowel disease for over 20 years. The ostomy gave me a new lease on life. Sure, I felt grief and sadness, but now I'm able to leave my house for long periods of time. I'm happier and I have become a much more active person. As a nurse, I understand that everyone's adjustment time and experience will be different from mine. Hopefully, though, I can share some tips and tricks that I learned along the way.
There are 3 new skills you will leave the hospital with: how to empty the pouch, how to change the appliance, and how to get the supplies you will need to your home. There's one thing that will put you back in the hospital quicker than anything else: dehydration. In fact, 1 in 5 patients will be readmitted to the hospital because of dehydration. Staying hydrated can be tricky after a surgery that messes with your bowels, let alone removes part or all of them. One of the functions of your large and small intestine is to absorb nutrients and water. This means you can drink a gallon of water and still be dehydrated. There are very basic warning signs for dehydration: low sodium or low potassium. If you are becoming dehydrated, you will have an increase in thirst, a dry mouth, dry skin, a decrease in urine output, a dark yellow to orange color of urine. You may also feel tired and may even get a headache. The signs of low sodium are feeling tired, loss of appetite, and you may experience leg cramps. For low potassium, you will feel tired and have significant muscle weakness. You may also feel short of breath. Consuming the right amount of fluids can be an overwhelming task at first. Keeping track of your intake and output is something you should do consistently for the first few weeks after surgery. Keeping a journal, whether it's handwritten or electronic, is a good idea. One of the best strategies for staying hydrated once you get home is the 1/3 and 2/3 strategy. This means 1/3 water and 2/3 sports drinks. Sounds crazy, but the sports drinks will give you the extra potassium and sodium you will need while your body is adjusting to the ostomy. Make sure those drinks are at a cooler temperature. Research shows that your stomach will absorb cool liquids better, and you want your stomach to absorb as much as it can. Your care team probably told you will need to consume 64 to 80 ounces of fluid every day. Oh, and it's not just any fluid. Water won't give you the nutrients that you need. You will need to use a combination of things like soups and sports drinks. Melissa has been living with this for a while. Let's have her help us out. So Melissa, it sounds like the biggest thing is to make a plan, make it convenient, easy, and give yourself credit. Write things down. Tell me about your reusable mug strategy.
Well, first off, I would always get a reusable mug and use that throughout the day and drink out of that so that I knew how many ounces I was drinking. And I would fill this up, and it was convenient and easy to use, and I could have it in different places in the house or carry it with me. And also, most gas stations also have you being able to refill it with water or Powerade or Gatorade, so that made it convenient.
And are there points during the day you use as a target?
Yes, in the mornings I would fill this up and try to drink it by lunchtime, so then I'm halfway through having my 64 ounces of fluid that I needed to drink. As well as I would oftentimes use emptying the pouch or using the restroom. After I would do that, I would try to drink 8 ounces of water or Powerade after that, and that would help out getting the fluids in.
Sounds like that's a great plan.
Yes.
Did you ever have a hard time remembering?
Always. I would always forget how I was doing that. So I would use different techniques to remember. One time I'd use a sticker method, and so I would take a sticker for how many ounces. This is a 20 ounce, and so then I would take as many stickers that would total up to 64 to 80 ounces, and then I would pull the sticker off each time that I drank a whole mug. And then sometimes I would use a hair tie, where I would wrap it onto the mug, and then after I drank, I would put it around my wrist. And then I would have it also as a reminder when I saw it on my wrist that I needed to drink. So it kind of killed two birds with one stone.
And what if you didn't have a mug handy?
Mugs are not always handy, and sometimes we don't like to carry them around. So then I would carry a case of Gatorade or Powerade or water in my car, or have it at my office so that I could conveniently grab a bottle and drink it.
So not everybody likes sports drinks.
No, I'm one of them. Did not like to drink sports drinks. And I talked to my doctor about that, and he gave me some great ideas. And one of the alternatives that we compromised was drinking lemonade. I don't mind drinking lemonade. And so what I did was I drank the lemonade, but I added salt to it because it does not have any salt to it. And then I would eat a banana to get my potassium.
Right.
Also, I don't mind drinking V8 juice, which is a really good source of sodium. And so I would drink that instead of the Powerade or Gatorade.
So it sounds like there aren't really hard and fast rules, just kind of being creative.
Creative and conscious, and it's changing your workup of remembering how to drink. If you're not a big drinker, it's a conscious effort to get those fluids in.
We've talked a lot about water and sports drinks. Are there other things to avoid?
Yeah, you can't drink quite a few different things that are probably really a big favorite of a lot of people, and that's caffeinated beverages like your diet colas or coffee. And then there's alcohol as well. Those don't count for intake of fluid that your doctor wants you to drink when you have an ostomy. Those are freebies, but you still have to be able to supplement with 8 ounces of fluid for every alcoholic or caffeinated beverage that you would drink. And the reason you don't want caffeine with your beverages that you're going to be drinking to get your fluid intake is they're a natural diuretic. So then it's going to increase the output of your ostomy as well, and you'll just get dehydrated. So sometimes it's really hard for people to go cold turkey and not drink caffeinated beverages or coffee. So if you're going to taper off, just remember that if you're going to drink a cup of coffee, you're going to need to follow it up with an 8 ounces of Gatorade or water, but Gatorade better just because you're going to get those electrolytes that you need.
Learn how to read the signs of your dehydration, low sodium and low potassium. Remember the 1/3, 2/3 rule when consuming fluid. Drink 64 to 80 ounces of fluid a day. Keep track of your progress. You are ultimately responsible for staying hydrated, but sometimes we understand there are things out of our control. If you are feeling dizzy or lightheaded, have little or no urine output, no output from your stoma, rapid pounding pulse, or can't get a full breath, please call your doctor or go to the emergency room.